This is how we're going to use our lab test. So if you have a doctor who's just said, TSH normal, they have not really looked further. What's interesting about this is, why is the TSH not that responsive? Here's an analogy. Think of the TSH as your parent, and the thyroid is the kid. So the parent says to the child, do your homework. If the thyroid, you have a healthy thyroid child, the kid says, great, does their homework, shows it to the parent, shows it to the parent, right, comes back up, the parent says, great, I don't have to yell at you again. And that's the way life goes. Do your homework, just talking in a normal voice, the kid does his homework, passes back up. That's what this sort of checks and balance is. What happens if this isn't functioning so well? The parent says, do your homework. Kid doesn't respond. Do your homework, right? It gets louder and louder. That's shooting this TSH up. Sometimes we'll catch that early, that you have a high TSH and then these numbers are low. So that's kind of a typical classical hypothyroidism that we're taught in the early part of med school, that's classic. But again, that's only those 2.5% of the population. So it's like the parent signaling the kid. What happens when the kid is not functioning right? So the parent is screaming at the kid's not getting up. After a while, the parent stops screaming, right? Because the kid is just lying on the couch. He's not doing his homework. So it's not so much that, so when we see this number being low, it just means it's non-responsive. It doesn't mean that the thyroid is doing its job. It doesn't mean that it's getting into every cell in the body.